My topic is depression, and my name is Pasha Shire. The depression has greatly increased due to COVID. There's been a higher prevalence among children and adults both. A little bit of background about depression. It was first documented in 400 BC, referred to as melancholy. It was thought to stem from demon possession and was typically treated by the priests or other high positioned people within the church. It's currently thought to come from both mental and physical causes, treated by a variety of professionals that include therapists, behavioralists, and medical physicians. Importance of depression is that it can lead to additional health risks, including diabetes. Diabetes can be related to a lack of desire to maintain healthy diet and exercise. Coronary artery disease is also one of the health risks associated with depression, and debilitation. With debilitation occurs whenever a person can no longer achieve or participate in normal daily activities due to overwhelming feelings of depression. Difficulty concentrating, fatigue, and even thoughts of suicide are signs of debilitating depression. The prevalence of depression is quite astronomical. It's estimated that 16 million adults are yearly treated or seek treatment according to behavioral health. It's also known as the silent killer because there's so many people that suffer from depression and do not seek treatment. The 16 million number is actually just an estimated number because researchers and professionals really do not know how many people are left untreated and do not seek help. Depression impacts many different people in different circumstances. In the past year with COVID, unemployment has skyrocketed, and a lot of those unemployed people were found to be suffering from depression after long periods of unemployment. Single parents were also affected, not being able to work or being able to work, but now they have to figure out what to do with their children because the schools started closing. A lot of single parents and homes with both parents were also forced to find ways to homeschool their children online and still be able to work or drawing unemployment. This also put a lot of families having more family time together, which also created signs of abuse and depression that normally wouldn't have been there just from added stress. Children started seeing a higher incidence of depression due to lack of social activities, isolations from friends, and society and media really, there's a dark stigma about depression. A lot of people think of it as an excuse, a weakness, that people that suffer from depression are considered to be outcasts. Men especially are thought to be unmasculine. It's not manly to be sad or to be unhappy. And sometimes people are thought to be a disgrace just because they have periods of sadness. Organizations that help and aid with depression are the Anxiety and Depression Association of America. There's also the Depression Center. Locally, Lifelinks is a mental health counseling facility that's in Mattoon, and they're available. They have day and evening appointments that they have, plus they also have support groups. Carl Clinic also has a referral program for mental health therapy at their main campus at the hospital, where they have a huge behavioral health program. And then Sarah Bush Lincoln Healthcare also has depression and counseling services. Support groups, or support for friends, and how you can help is to be aware of changes in your friends and family. Those changes would include isolation, lack of interest, excess sleeping or eating, and a decline in personal care. Make sure that you always listen. A lot of times people that are depressed just need somebody to talk to. They just need somebody to listen. You could also start a support group on campus or in your local community. If you're feeling depressed yourself, you can reach out to an instructor, staff, counseling services. I've listed several numbers here. Suicide prevention number is 1-800-273-8255. Substance abuse, 1-800-662-4357. There's a crisis text line where you text the word home to 741-741. Senior citizens over 60 can call this friendship line, and it's staffed by people that have expertise in dealing with the elderly and depression and suicidal tendencies. Their number is 1-800-971-0061. And then there's the Veterans Crisis Line, which is 1-800-273-8255. There's also a text option that's 838-255.